So, good evening, everyone. Welcome to Medical Mondays with Dr. O. I am Dr. Toyin Okwesomi. I'm a physician in Maryland, and I love to learn and at the same time to teach whenever the opportunity arises. Medical Monday is a forum where we all come together as a family, as a village to learn. And tonight we have one of our very own, Dr. Oluyemisi Famuyiwa, who is going to talk to us about something that is becoming an epidemic in our society, our African society. Infertility, to be specific, but tonight she will be talking more on surrogacy and understanding it. So without further ado, Dr. Famuyiwa, the floor is yours.
Thank you so much for that kind introduction, Dr. Okwesomi. I totally enjoyed this forum. It feels like home. I feel welcome and I feel the warm love. Thank you. So I'm going to go a little bit into surrogacy. I just have a few slides because I mostly want this discussion to be more interactive. And the first thing we want to do is sort of define what surrogacy is. So surrogacy is when a woman or anyone for that matter is unable, for whatever reason, for lack of a uterus or medical problems or psychological problems, is unable to go through pregnancy themselves, right? And there are two types. Either you have a traditional surrogacy or a gestational surrogacy, with the main difference being the person who's going to carry the baby may also be the individual that supplies her own eggs to be fertilized and do IVF and carry the baby. That is usually very rare nowadays. Mostly what you do is the embryo is implanted in the surrogate, and the egg that went into creating the embryo may come from the intended parents or from an egg donor or an egg bank if the intended parents cannot or are not able to produce eggs of their own. So that's roughly the definition of surrogacy. Surrogacy has been going on for ages, ages, and in different societies for different reasons. We probably have had it in Africa for a long time, except, maybe kept hush hush is not something you would discuss, right? So tonight, what I'd like to do is sort of go over some of the medical aspects of surrogacy. And when I say medical aspects, both what may lead to surrogacy and also the medical requirements for a surrogate, because not everyone can be a surrogate, and also touch a little bit about some of the legal requirements as we live in the US of A. You can't just up and just do surrogacy. There are some rules and laws, and in some states in America, surrogacy is outlawed completely. In other states, there's a more friendly approach to it. There's no overarching federal law about it, so each state is allowed to define their own. And then the last fact is to talk about what are the psychological aspects of surrogacy, both for the intended parents as well as for the surrogate involved. And maybe finally we can talk about, so you want to do this, where do you go? How do you gather information? Where do you even start? All right. So with that much said, let me see, my slides are working here. And okay. So I already talked about the aims of the webinar tonight. We're going to talk about the medical perspective, psychological perspective, legal perspective, and also the ethical considerations and best practices, at least within the United States, right? And I would think most of these best practices can apply in some international places as well. And I'll cite a case in point, such as India, that had to end up banning surrogacy because best practices were not being followed. So When you look at the perspective of the medical perspective, I'm going to talk a little bit about, I think Dr. O had asked me, why would anyone need a surrogate? And the simple answer is if you are not able to carry the pregnancy, as I've said, for medical reasons, psychological reasons, whatever reason, or you don't have a uterus period, then it would require trying to use a surrogate. Now, we have gone into some of the things that could affect someone's uterus that would precipitate needing a surrogate in our previous webinars, but I would be more than happy to come back and elaborate on that later on. But I think if we try to tackle that, we're not going to get through tonight. So, for the medical perspective, therefore, let's focus on the medical perspective as it relates to the person who will carry the pregnancy. In other words, the surrogate. The first thing you want to look at the age. Now, medically in the US, they say someone of age 22 to what, 41, but you want to be careful. You probably don't want someone that young, right? Unless it's someone doing it for family reasons and stuff, because there's a level of maturity that goes into this. And you want someone who has had a previously successful pregnancy without complications. In other words, they haven't had preeclampsia, they haven't had pregnancy induced hypertension, they haven't had preterm labor, they weren't bedridden, the beginning of the pregnancy or had seizures or any number of things. Those are important. Then you want to look at the physical health of the surrogate. What is their BMI? Because we know that if the BMI is too high, there's a probability that the embryo you implant may not implant. And you would have spent a lot of money to come to that conclusion that you probably shouldn't have used this particular donor. Now, the mental health is important. So, if someone is severely depressed, actively psychotic, how are they going to manage the pregnancy? Are they going to be able to attend all the visits that's required? Will they have the mental capacity to take good care of themselves? And that goes into lifestyle and habits. And also, what are their emotional and psychological support system? A gestational surrogate who may be in a family structure, a family unit, may have slightly more support available to her from her family members. Let's say she wants to go to the visits, or she needs help with her own daycare situation, or maybe sometimes she's going through this and it's just very difficult and she needs someone to support her throughout. So all those things matter. They do matter. What is their lifestyle? Is it someone that's imbibing in alcohol? Is it a smoker? Do they live with other smokers or substance abusers? What is their family situation? So you might want to look at that. The other thing you of course do, and that goes into the health, is to do medical screening for infectious diseases, make sure they're not HIV positive, make sure they don't have fulminant hepatitis, syphilis, or such like that. And then, what is their uterine health? What does that mean? Do they have fibroids? Do they have adenomyosis? Have they had multiple D&Cs where they have scar tissue? So, in essence, when a surrogate is selected, they have to go through a medical clearance. So, they would have to be seen by the clinic who is going to put together all of this before saying, check, I approve of this particular surrogate. Now, this matters because there have been case reports of women who had, severe problems in pregnancies, delivered early, had severe hypertension, and that was not divulged to the intended parent. So the parent went ahead with the surrogate and they end up having a preterm 26-week birth that would now require the ICU, would require intensive therapy. And if that birth occurs in a facility that cannot handle that, that could be a problem, right? So those are all the things that you want to look at. Now, the other aspects that I want to talk about is what do you do when, and um, I think I'm jumping ahead of myself a little bit. We'll talk about a case scenario in America at least, okay? Before you engage the services of a surrogate, you have to do certain tests yourself because your eggs and sperm is as if you are donating eggs or sperm to the surrogate. As such, the intended parents must undergo rigorous infectious disease screening themselves because in this case, the law is going to protect the surrogate, right? They don't want you to pass on any infectious disease to someone who's genuinely trying to help you out. So, one of the things, at least in the US, is the sperm source is treated as if it's coming from a sperm bank. Now, what do I mean by that? Anyone that donates sperm to a sperm bank must be screened by certain FDA required testing. Those testing are quite rigorous, almost as if you're donating heart and lungs or something like that. So the infectious disease screening required cannot come from a regular LabCorp or Quest. It has to go to an FDA affiliated cleared lab, and in which case is maybe run by LabCorp or run by Quest, but it's not their regular branch. And I know the one for LabCorp is called Viromed, right? And it's a whole different facility from regular LabCorp, where they're required to test for HIV, hepatitis B, hepatitis C, syphilis, right? And then they collect the sperm. That sperm cannot be used, and if it's used, the embryo created cannot be replaced into a surrogate until the sperm donor, the person from which the sperm came, is retested in 6 months for some of this blood work as well. Now, if the sperm is collected, say in summer, at least in the US, you have to screen the sperm source for West Nile virus. And even though Zika virus is not rampant, you need to at least give them a questionnaire about any exposure to the Zika virus, right? So there also is a questionnaire that's extremely detailed that you have to go through with the sperm source and also the egg source, actually. But the particular thing about the sperm is that you can't use it, you can't touch it, you can't put another human being until you retest the person. And that's how all sperm banks operate, at least within the US. Now, in other countries, that may not be the case, right? So, but it's quite rigorous. Now, the person, and oh, by the way, they have to go through a physical too as well. So the sperm collection, the physical exam that they need, and the blood test and the questionnaire has to be all collected within 7 days. Okay. The person who's giving the egg has to do similar testing. They have to do questionnaire and physical, except with the egg, you have up to 30 days to do all the things that you need, and you don't need the 6 months quarantine. So that's what the person who's giving the eggs and the sperm, and in this case, the sperm the donor has to be retested. Now, the so that is the infectious disease part. The other part that's needed is there has to be psychological evaluation of the intended parents as well as the surrogate. Both intended parents and surrogate have to undergo psychological evaluation by a licensed psychologist to make sure that they are well aware of what they're getting themselves involved in. Okay. So there has to be psychological evaluation by both the intended parent as well as the surrogate. The psychologist for both the intended parent and the surrogate cannot be the same. It has to be separate, right? Psychologist. So at the end of this, the intended parent and the surrogate are now evaluated together in a joint counseling session by one of the psychologists that had participated either with the intended parent or with the surrogate, right? So that all has to be done, right? Because you want to make sure that the surrogate is not being coerced. I remember in a case, one of my patients um, came to me and they were trying to coerce, I think, her younger sister because she was financially dependent. And I said, that's not right. That's not informed consent. There can be no coercion whatsoever. Okay. The other part is the intended parents and the surrogate both need their own individual lawyers, someone to represent their best interest. So you cannot use the same lawyer for both, right? And the lawyers have to make sure that they represent to the best of their ability their each person's either the intended parent or the surrogate. Okay, so you have legal representation, psychological evaluation, and then medical part is what is involved. Okay, so um, one of the things that when we look at best practices, you have to look at different laws have different laws for surrogacy. For instance, if you look at Michigan, surrogacy is illegal. In Maryland, it's allowed. And what has to happen is the lawyer has to go to court and get a birth order from around 16, 18 weeks pregnancy. They have to go to court and sign where the birth certificate of the child will have the name of the intended parents. So the surrogate, name would not be on it. Now, if your surrogate delivers in a country, in a state where surrogacy is illegal, then you may have to go contest for your child. And if the surrogate decides that, you know what, I don't want to give this child up. This is my child. I gave birth to this child. They may have a legal right. So you need to know what the laws are for the particular state you're in, right? You need to iron out all the clauses. One of the things that you have to iron out, what if the intended parents die before the birth of the child? Who's going to raise the child, right? You have to make provision such that the surrogate may say, well, I don't want to be stuck with the baby. That's not what I bargained for. All those things you need to sort out, right? Before birth. And there's, you have to sort out the contracts that you will write between the intended parents and the surrogate per se. So now I'm going to sort of finish up my presentation and open this for discussion. And the last slide just says that the surrogate must be willing and fully informed for this about the surrogacy process, including the legal and emotional aspects. So I'm going to open up so that we can have a discussion.
Fantastic. Thank you so much. That was deep. And I am so excited that psychological interests are being, served, because that is very, very important. I have questions though, but I have to defer I have questions, I have them written down. I have to defer to Mrs. Tower, Miss or Mrs. Tower, correct? iPhone Tower. You can unmute and ask a question. Good. You are muted.
Good morning, everyone.
Auntie Tower, you look different. Look at you.
Because, yeah, I have to. It's just necessary.
Auntie Tower, you look so young. Look.
I saw my face last week, so now to show my face.
Wow.
Dr. Famuyiwa, thank you very much.
Good evening, ma'am.
Good evening. Good evening, everyone, for the wonderful presentation. Thank you. My question is about, is it possible for the body of the surrogate or the uterus to reject the eggs and the sperm? Because it's like a foreign body to her body.
Probably not. Probably not. Yeah.
Okay.
So it's you know, they probably can do just fine.
Thank you very much. It's a small question.
Yes. Yeah.
Well,
is there not a synchronization?
Just one second, Dr. Gazelle. The sperm is always a foreign body too, if we want to look at it that way. To the female receiving it. So rejection does not occur.
Correct.
Yeah. So Dr. Gazelle, go ahead, unmute.
No, I was just going to, do a follow-up to that question, that is there not a synchronization, of the cycles of the surrogates and, the intended, mother, where this is not traditional surrogacy?
You don't need to do that. We have so many tricks up our sleeves right now. We can prepare the uterus, at any point. It's not so much synchronizing the gestational surrogate with the intended parents, because at least in America, and I know it's occurring all over the world right now, you actually test the embryo to make sure it's genetically normal before you transfer into the uterus. So that takes a little while to get the results back, probably several weeks. So trying to synchronize both, it's very difficult to do. So you just go ahead and freeze the embryos. Once you create them, biopsy them to test to make sure that they're normal. And then you can now work on the surrogate. If anything, what you might want to do, you can synchronize the gestational surrogate's menstrual cycle and use her own menstrual cycle to time when you put the embryo in, or you could prepare the surrogate using medications nowadays to prepare the lining and then transfer the embryo at the appropriate time.
Thank you. Yes, I meant the menstrual cycle of,
correct,
of the two. That was what I meant.
Yes, you can do that. And you can also do without.
Okay. So I do have a question of my own though. So okay. So and that relates to international surrogacy.
Yeah.
Again, given the cost, we are in the US, we know how cheap things are. And so what laws govern international surrogacy? Thank you.
So I have no idea. You have to research, buyer beware. You're on your own. We certainly have shipped embryos really all over the world for surrogate. We used to ship embryos to Ukraine. I had parents who successfully picked up their babies from Ukraine. Ukraine back then used to be a cradle for high-tech hospitals. So if the pregnancy ran into complications, they were quite comfortable handling it. Since the war, that has obviously stopped. I've also shipped embryos to India in the past, but I think that there were so many excesses and a lot of women that were coerced and sort of almost incarcerated, if you will, against their own will to use them as surrogates. So a lot of abuses went on. And I think India finally banned surrogacy to protect its own citizens. So every country has its own. I know that there's surrogacy in Nigeria. I have no idea about the laws there. I can't speak to that. If you go overseas, you have to make sure that, like I said, if the baby is born prematurely, what are your arrangements, right? So if do they have an ICU facility? Are you going to medevac the baby out? You know, what's your game plan if there's a complication? Now, if there's no complication, you're fine. I had a patient of mine who told me that he and his friend were looking, his friend went to Mexico, and this was a single father. He wasn't married and wanted a surrogate. So, and apparently ran into a nightmarish instance. And his friend who saw him, who also wanted to be a single father, said, "No way, Jose." I've had patients who've been to Argentina and had mixed results as well. So you really have to know, right? You have to do your background check. What are the contingencies? What are the laws? Like I said, buyer beware.
Thank you. So I have a question in the chat box that says, just curious, what happens to the 600 surrogate babies that were trapped in Ukraine when Russia attacked them?
That's
Do you have
out
an
of
idea?
I have no clue. I know that our patient successfully went and got her baby right as the war was starting. But, the Ukrainian doctors are very resourceful. A lot of those embryos were actually shipped to different countries, and I think some of them may have reestablished in other countries and are doing quite well. As for the surrogates, I don't know.
Wow. So I'm surprised that we have like 600 surrogate babies, there at that time. But I have questions, and Dr. Gazelle started, the train actually, and this is to do with surrogacy in Nigeria and Ghana. Right. That I have personal experience with, not personal. I know people who have done it. I know a couple who did surrogacy in Ghana, and the husband flew I think it's the fertilized ovum. I don't know what stage you send it, but he flew it to Ghana himself. And I'm not sure if he met the surrogate mother or not, but they successfully had a daughter and then went back to pick the daughter.
Yeah.
I know another couple.
Yeah. Mm-hmm.
I know another couple who did this in Nigeria.
Correct.
And they never met the surrogate mother. So when you talked about the counseling occurring between the surrogate mother and the parents, I thought of that didn't happen. They didn't even go at all. They shipped whatever the embryos, like you said, but it was from both of them.
Right.
Their sperm, their egg, shipped it to Nigeria. The surrogate mother had the baby. They landed in Nigeria the day she was having the baby. And the baby was taken from the surrogate mother and given to a family member that was there because of logistics, they were not going to be there exactly at that time. I'm not sure if it was C-section or natural delivery. I'm not sure, but the baby was taken right after, but the surrogate mother did not see the baby, basically. And, you know, the family member took the baby, they came from the airport and they got their baby, and the baby was here within, I think, a week or two, because it's their DNA, and they were able to get the passport right away. And that worked. But they didn't have all of those psychological.
Yeah, I believe the psychological part. I have worked with a clinic in Nigeria who actually uses an agency, and they did do all the psychological evaluation. They actually also had legal representation, and that's one of the top-notch clinics in Nigeria that I send embryos to a lot. So you kind of have to do your background search. I think it's important to have the psychological evaluation. I think it's important to have the legal representation, but also understand these women are helping. At least that was the way I would approach it. They're not, you know, birthing cows, right? Just popping babies out to be. So there is a part of them that's attached to this baby as well. So you need to work through all those emotions. And I think that's where evaluation is really, to me, important. I had a patient once, they brought their own surrogate, and I think she had the psychological evaluation, she had support. She was a single mother, but she was dating someone who was extremely supportive. She lived with her mother, and her siblings were there. So there were so many people to help her with her own kids, and she felt convinced that this was the right thing for her and she was going to be okay. So after the psychological evaluation and the legal preparation and everything, she went through it. And one of the things was, I think she was a little bit naive and she didn't use her medication correctly, like for twice, and miscarried. And I told her, well, yeah, you stopped using. And the intended parents had to like set a timer, and they would call her at the exact time. Okay, it's time to take this medication. Oh, so they were communicating, and she delivered, and everything was happy. And she gave over the baby, but then she told me, frankly, that she would never do it again because she never knew that it would. She felt she didn't know she was going to be that attached, right? So she said she would never do it again. And I've had another surrogate who did meet the parents. I think it's easier for the surrogates if they know the parents, right? So they form a bond. They become like a family. So and they helped her throughout. They talked, they chatted, and it was almost like an aunt in the family helping them. And there was no such psychological trauma handing over the baby, and she's fine. And I think they're even friends. And also, I saw another surrogate who's here, whose intended parents are actually in Israel. And the unique thing about them is they actually formed friendships with her family. So, like, they knew her husband, they would talk to the husband, they got to know her children, and they would have FaceTime calls. And the children felt like, yes, mommy is actually helping this wonderful people who are like our family, and she's helping them complete their family so that they can be like us, so they can have children. And the whole family was totally behind it. I've never seen such bonding, even though the intended parents were half a world away. They made this woman feel welcome. They made her feel valuable, valued, respected, honored. She was part of their family, right? And that's one of the advantage of using a surrogate close by. You want to know who's carrying your child, what kind of person is this person, how close can I get to this person? And also, I found out, like certain Jewish practices, it's important to them to know the religion of the surrogate. Otherwise, they have to do certain rites after the child is born, right? So all those things matter. So you don't want to degrade the process to just a financial transaction. I think psychologically, it may be harmful, if not to the surrogate, maybe even to the intended parents.
Wow, excellent. My other question was going to be, have you ever seen a surrogate get attached to the baby? And, have you seen one?
I think that yes, they do sometimes get attached. It's a pregnancy, right? But you have to be careful about the law, right? So in certain states, like we said, the surrogate may decide not to give the child, right? So, you have to look at what state you're in, right? Some states in Maryland, it doesn't matter. So you have to, those are things, it's like when you have a prenuptial, those are the arrangements that you have beforehand, right? You have those discussions before. Um, I know that one of the clinics that we use overseas, they actually had an agency, they had legal representation and everything. So they did everything by the book, and everybody was happy with the outcome.
Fantastic. Thank you. Dr. Ajagbe, kindly unmute, sir. You have your hand raised. There you go.
Hello. Sorry, I'm driving, so you won't see me. My question, one of my questions has been addressed. That's the issue about the surrogate not wanting to give up the baby. And then the other, that's been addressed. So the other question I wanted to ask is that how do you deal with the baby blues that may arise for the surrogate mother?
Yeah, I think that's very, very important because the baby blues that you're talking about is postpartum depression, right? And that's where having psychological support before and after is exquisitely important. Like I gave you an example of the surrogate that said she was okay. She went through psychological evaluation, everything panned out, and she went through the process and she said she would never do that again. She never knew the emotions she would have to go through. She was just not prepared emotionally. And she swore she would never do it again. Right. So those are things that need to be parsed out before and after.
Dr. Jagos, your question answered. Fantastic. So I have a question here that says, from Dr. Alu. He said, thanks, Dr. Oluyemisi, for the insightful presentation. Is surrogacy scriptural or scriptural?
So again, I'm not a priest or anything, but if you look at it from the point of view of what are you trying to accomplish? Are you trying to help a family, right? I mean, how is it different? I'm sure you've heard instances of grandmothers who actually carried their children's embryos because their child could not deliver, right? What would they do without the grandmother stepping in? That child will never be born, right? So it you have to look at from how are you doing it, and what are the ultimate motives behind, right? You have to know why you are getting involved, and the surrogate cannot be coerced, either financially or psychologically, the surrogate cannot be coerced.
Oh, I was looking to see, I know that we have on the forum, Pastor and their Dr. and Dr. Ajay. Can one of you please start that question? And then Dr. Izugu, I'm going to ask for your input too on that question of spirituality. Is surrogacy scriptural? Dr. and Dr. Ajay, can one of you please answer that question?
I am driving, but I will say real quick that you look at the story of the Israelites, the 12 brothers, is exact replica of what we are talking about. You would think Jacob had the children from one mother, but that wasn't the case. That's one typical example. Another example would be our father Abraham, where a guy had to come in to get Ishmael. So that is also another replica of what we are talking about today. It is deep, and it's a deep study that one have to make. Again, this is the way God operates. God is always God, and we are always men, or we are always human. Let me say it that way. He will decide to do what he will do. Somebody will say, why am I saying this? I'm saying it for the fact that look at Abraham, who lied, but yet God called him, this is my friend. You will lie. Okay, let me not put it on you directly. But in the New Testament, Sapphira and Ananias lied, and they were kicked dead right away. They were never called friend of God or nothing like that. So God is God. He does things in his own way that we human will not always catch it. But it's God. It says, as far as the east, the distance from the east to the west, the north to the south, is how deep the knowledge of God is from human being. I don't know if I'm making it right, but this is the brief I can give for now. Thank you so much, Dr.
Thank you so much. I never saw things from that perspective. And Dr. Izugu, your perspective, and I want your perspective because, yeah, you're a cardiologist, but you are also a minister, and your input is important here.
We give God all the glory, and thanks again for that presentation. We have instances in the Bible where, and I'll give you an example where when Judah even asked the son Onan to go in, to his brother's wife and have a child for the brother's wife. And as a matter of fact, when Onan, when he goes in with the brother's wife, he will spill the sperm. And God actually punished Onan for doing that, actually. So I think there are instances, where, I think surrogate is in the Bible. And we also have, as you mentioned in the beginning, that even though there's a hush-hush in Africa, there have been situations where families will get, say, go in and have a child for your brother who cannot have a child, and these things happen and it's never known. So I believe it's biblical. The main thing is to bring in a good citizen and raise up a good citizen to spread the kingdom of God. It doesn't matter how. Yeah, that's my take on that. Thank you.
Thank you so very much, both of you. I learned something, but I want to look at the aspect of maybe where Dr. Alu is coming from, where, when this is done, it's done the same way in scripture, like you said. Go into this woman, they do it like that sometimes, but sometimes they actually use the sperm to fertilize the egg and then implant it into the woman. So it bypasses really having to have physical, interaction with the surrogate. And I want to venture to say that it is God that gave us the wisdom to do that. I believe, and I know for a fact that we have only one physician, and it is the Lord God Almighty.
And I will chip in
But
real quick. Sorry to cut you, Ricky. So
go ahead.
God said that in the end time, knowledge will increase. And that's where we
Yes.
are. And that's why we have the medical or the sciences. I'm not going to the extreme of it, but the sciences bringing out this knowledge, these experiences as to why we shouldn't, or why we are not going through the same route, where we are bringing another person to have a child for another person. But now it is done the way you are eliminating the process of that part. I don't know if I'm making that clearly to you. Or, okay, let me stop here so we can continue. Sorry about that.
Yes, you're right on the money. That's it. And thank you, because that's the verse that, I was thinking, that was on my mind to share, that God said he will give us knowledge, and he is giving us, little by little. Like he said, we get it in medicine through research. And as I was saying, God Almighty is the only physician, but he uses tools like us, Dr. Famuyiwa, Dr. Izugu, Dr. Motosha on the platform, and other doctors. He uses us as his tools when he chooses to, and he's the one who gives us the wisdom. Dr. Gazelle, through research, the research is like the ones that Dr. Gazelle does, to gain knowledge so that we can know how to approach things better. Dr. Famuyiwa is to talk about our residency experience and what she knew then, what was available to us then, compared to what is available to us today. It'll be mind-boggling that, oh, wow, we've gone yards, miles in fertility, in helping women to conceive. So I believe, like my brothers here have said, and our sister, Dr. Famuyiwa, that this is scriptural. My belief also. So thank you so much for those depths, everyone. That's an excellent question. There's another question, Dr. Famuyiwa. Must the egg used be the surrogates?
Not at all. And it's probably even better if the answer to that is no. Right? It's, you can have an egg donor, you can have a different donor. It's probably simpler to separate those.
Fantastic. So Dr. Gazelle said, thank you, Dr. Famuyiwa. He said he's glad we live here where the laws are there and enforced. What happens where we have unregulated surrogacy or difficult economic situations that force people into surrogacy?
And I think I've touched a little bit on that. And I gave you an example of what happened in India, where women were being warehoused in dorms, and and they would have to stay there till they delivered, and the government put an end to that. Now, I am, not the government, but it is the duty of the government in any country to protect its citizens. So if they notice that certain practices are going on, that in clinics that, the clinic I partner with in Nigeria is an excellent clinic, and they do everything by the law, and they have lawyers, they have an agency, they have medical care. They put a surrogate in an apartment with a matron to watch them. If you're going to a place that may be cheaper, then you get what you pay for, right? So there will be instances where people are being abused. I think that there are instances, for instance, people who get donor eggs from certain foreign donor egg banks, for instance, that's like that, where they found out some of those egg donors were trafficked, right? So you have to be careful where cheap is as cheap gets, and you want to raise your child. I think you would be very well vested in in where the egg of that creates your child comes from, or sperm in any case, and who's going to carry and bring the egg and bring the baby to life. So I would think that you want to pay attention to these things because, there is something called epigenetics, right? Epigenetics refers to the environment in which something is developed. So if your embryo is in an environment that's extremely hostile, it may leave certain imprinting factors on that child. And you may have problems down the road because you were looking for cheap and you got cheap. Except now you got to deal with it for the rest of your life because of whatever that particular person was exposed to. I mean, we all know that, maternal health care is exquisitely important during pregnancy, right? What is the surrogate eating? What is their environment? What are they exposed to any toxins? Because they can't afford anything better. All those things matter because, whatever it is they're exposed to is what your baby is going to be exposed to. So if you're okay with it, that's fine, you know. But if you want to be careful and do your homework, you don't just go with, cheap.
You get what you pay for.
Exactly.
Whew, thank you so much, because in a nutshell, you have told us so much. Dr. Jagbe, go ahead and ask your question, sir. You can unmute, sir.
Another question that comes to mind is, how do we deal with the issue of breastfeeding?
Excellent. Yes. So those are things that, again, you need to sort out these questions before. A lot of times the surrogate may breastfeed, right? If you've both agreed upon it. I've also had one of my patients that actually, went to India to pick up her babies way before when she started conditioning herself, taking hormones and using a breast pump. And when her babies were born, she had twins, she was able to actually breastfeed them successfully, right? So those are issues that need to be sorted out before. And if you decide that no breastfeeding will be involved and you're going to bottle feed, again, that's a choice. That's a choice you make. You can certainly do that as well.
There's also breast milk bank.
Yes.
We have breast milk banks that people actually utilize, whether in surrogacy or not.
Correct. Absolutely.
That's an excellent question. Wow. So this is surrogacy that we're talking about. Okay, I'm going to leave it there. I have questions, but Dr. Buka, you can ask your question. Kindly unmute.
Thank you, Yemisi, as usual. I thought I wouldn't listen, but when Yemisi is talking, I know I would learn something.
Thank you. Thank you.
And I actually saw a surrogate who I gave anesthesia to, and she didn't have anything to do with the baby. I also saw a mother who carried the baby for her daughter, right there at Holy Cross. But the question I have, let's say you get a donor egg, and the donor egg is used, the mother carries it, the donor egg. Does the baby get any DNA component from the mother, even though she didn't provide the egg?
Not at all. Epigenetics, maybe, your environment, maybe, but no DNA per se, no.
Okay, so there's no genetic component from the surrogate? No. Oh, okay. Interesting. Thank you.
You're welcome. Nice to see you.
See, and I think that's why there was a question earlier. I think it was Auntie Tawa that asked the question if there is the possibility of rejection. That's another reason why there will be no rejection. They are just carriers. Yeah.
Yeah, but even with that, could we imagine the resource issue, resource incompatibility?
You mean rhesus, right? So
Right,
blood type.
research, right. Yes.
Oh, blood type. Okay.
Yeah, blood type. So, I mean, again, those are some things you look at. But remember, again, you have to look at those things and make sure, has the surrogate been exposed to an RH, if the surrogate is RH negative, for instance, and was previously exposed to an RH positive baby and developed antibodies, and that wasn't adequately treated, then they could make antibodies to attack the baby and have serious medical problems. I would imagine that most places have ROGAM. I would imagine. And I think they have ROGAM in Nigeria as well. So usually such women would have been given ROGAM antenatally. Now, again, if you go to a place where I can't vouch for, and those things are unheard of, and the necessarily screening was not done, again, buyer beware.
Thank you.
Yeah.
Thank you. So there's another question here. At what age can one act as surrogate? I think that was mentioned.
Yeah, I did go over the age, right? So you want someone, 41 or younger. They start getting 44, 45, maybe if they're extremely healthy, but you certainly don't want someone over the age of 44, 45, because pregnancy is high risk by itself, right? I mean, just because women are getting pregnant every day and delivering babies every day, not everyone goes through pregnancy unscathed, right? So, pregnancy is a high risk complication by itself. When you throw in someone who's much older, you increase the risk. Can they do it successfully? Yes, but there's always going to be the one or so case where you have serious complications. So you really want to know, that the age of the surrogate.
When one is doing in vitro fertilization, there's a cutting age too, right?
Right.
The cut is 40.
Well, so for the IVF, yes, the IVF, the age cutoff, or so most clinics will do, has not to do with the uterus, more to do with the age of the egg, right? So the older the woman is, the older her eggs are, the harder it is to fertilize. So that's where you might see some people cutting off by age, because then the success rate is, like, for someone who's 46 and older, is almost like 1% or less than that.
Fantastic. Thank you so very much. This has been a robust conversation. And Sister Clementina kept saying over and over, thank you, Dr. Famuyiwa. Thanks again. Love this presentation. And I'm sure, you know how I'm going to be reverting back to you that somebody needs you. They want more of this. Thank you so very much. And thank you, everyone, for listening. What would be your advice to someone who is considering this, as to conclude this talk before I update us on Dr. Wale Akose? So please,
yes.
everyone, I'm going to update right after this, but what would be your advice to somebody who is in this position and are considering surrogate?
So the first thing is your homework, your homework, your homework. You can't cheat on that homework. You got to do your homework and gather as much information as possible. You might consider involving a gestational surrogate agency, or a company that looks for agencies, or clinics that may have affiliations with surrogate agencies that can help you resources. You want to know, because those agencies may then become your gatekeeper if you're in the US, right? They're your gatekeeper. They can put you in touch with the lawyers, the psychologists, the medical clearance. They sort of act as a gatekeeper to keep everything on track. Overseas, some clinics are these gatekeepers, but the good ones still use a gestational surrogate. They have the lawyers involved and the medical part. So it calls for a lot of patience. It's not something you rush to, something you have to plan, and it's expensive. So part of that is also making plans. Like, how are you going to gradually put this money together? How much do you pay when? Those you do by, again, getting out a spreadsheet, doing your homework, getting your data. And it's not something that you can rush through. It might take you several months to get the right data, and there should be no rush, right? Because this is going to change the rest of your life. So that's where I would start with is do your homework.
Fantastic. I'm already getting requests for your contact. I will give your office contact.
Thank you.
But please, I'm going to ask them anyone contacting you to let you know that they are from Medical Mondays with Dr. O, so you can give them discount.
Absolutely. Please, when you call, reference Medical Mondays. We love working with Dr. O's platform. And like I said, I enjoy being here. You guys have always been kind to me.
Thank you.
I love it. Thank you.
Thank you. We appreciate you so much because you've done amazing. And you've helped our people actually conceive women who have not been able to conceive and have been to so many places. You have helped them and they've had successful deliveries. And so thank you so much. We appreciate you.
Thank you. Thank you.
So I'd like to update us on Dr. Wale Akose. I don't know how many of us were on this platform a few weeks ago when I brought Dr. Akose on, a man who was contemplating suicide and was actually going to commit suicide within 48 hours because he had no place to stay and he's been on dialysis for 7 years. Amazing young man, very intelligent. On the verge of his multi-million-dollar company before he was misdiagnosed and, had, past history now, okay, and had to be on dialysis and had been on dialysis for 7 years. So we chatted on Medical Mondays. My purpose of bringing him on is actually for us to learn so that we can navigate the medical system properly, and because doctors are not God. I said it earlier. He's the only physician, God is. And so that we can navigate properly and be sensitive to what is going on in our bodies and prevent stuff like that was the reason I brought him on. But Medical Mondays family, the most amazing family, you all decided to contribute money right away to assist him. Dr. Malcolm Fabiyi was the first person to pay the $2,000 for the 30 days that we got for him for extended stay America, for him to stay there so that it can buy us the time to find him a permanent space. And I paid the $1,200 for the move that was done over a couple of days. And so I want to share what happened, and I hope I can do this well. I pulled it up already. If I can find. So it took some work, a lot of work, but Dr. Wale has been situated. I was blessed to be directed by someone to the Montgomery County how do you call it? They have an office that helps people who need assistance in the county. And I don't know why I'm blacking out on their name right now. But I connected with them, introduced myself, and told them what our need was. And they were graceful. We were blessed to have a lady who just decided to take him on, connected him, and they got him a place that they pay him for the year for him. So I'm going to share my screen and to share an email with you because it's the best way I can do it. If you remember when you contributed a few weeks ago, can you see my screen, please? Can you see my screen?
Yes. Yes,
Okay.
we can.
When you contributed a few weeks ago, thank you. You contributed to the Nigerian Center so that we can get tax deduction from the contribution. So these are the names of people who contributed. You can see your name on it. Some people, I think they probably don't want their names to be mentioned, sent their contribution to me, 3 people in all, and I forwarded the money to the Nigerian Center. One of them was $300, one $250, and the other $1,000. I've texted to ask if they would like me to mention their names along with this, but I've not gotten responses back. So I will not disclose their names unless they give me permission to. The last 3 people on this list are not part of the money contributed. Mr. Benga Ogunjimi of the founder of Nigerian Center, actually, if you see up here, contributed $1,000. But the $100 here was for something else. You know, the last 3 just got lumped up somehow in there. So this is now the breakdown from Mr. Ogunjimi, congratulating Wale here for getting a place and now explaining what monies came in and how it was spent. So this reads, if you cannot read it, it says, congratulations once again on your new apartment. I wanted to provide you with an update on the donations received through the Nigerian Center. The total amount received after deducting a 4% transaction fee was $4,682. After settling your extended stay bill of $1,305.75, the remaining balance is $3,376.25. Medical Mondays family, again, I want to say a huge thank you. We exceeded the 30 days at the extended stay. You don't want to know how many calls I made. Because of the dialysis, it was somewhat difficult to find a place for him or somebody who would help. Immediately they hear hemodialysis, they can't handle it because they don't have facility for it to give free room and board. So he stayed over at the extended stay, and the cost, because it's not per month, was a little bit higher. So that's what the $1,305.75 was for. And he said you will receive the payment in 2 checks. as the recent 1,000 donation that I just mentioned, somebody sent me $1,000 through Dr. Okwesomi is still in the processing stage. You should expect to receive it by next week. A check of $2,376.25 will be mailed out to your new address that day. That was October 31st. And, other things were then shared there. So that's the update for Dr. Wale Akose. We are grateful to God that he has a place for a year. So do we have any questions so far before I, say my next need?
Yes, didn't he get, I think he was offered a job as well, wasn't he?
That's an excellent question. That was what I thought that night on the platform, but it ended up not being that, and I'll explain that. That's the next thing I wanted to talk about. And Sister Tinu, Kaiser Permanente in Maryland does not do the same thing. It's actually with Kaiser Permanente here for his healthcare, but they don't do that here. In California, Kaiser Permanente, I think, is the best in California, or their system is somewhat different from what I have seen. So they don't do that. Somebody did talk about offering him a job, that day, and I followed up. The person then said that they would help him to navigate where he can get jobs, things he can do, and stuff like that. And, I wanted him to be situated, to be rested before connecting him. I talked to him yesterday and, promised to connect him to this person so that, hopefully he will be able to get something doing. The next step is what you just asked, Sister Karen. He needs a job because he needs to be able to, continue to fend for himself, eat, basic needs and stuff like that. Not only that, this place is for 1 year. 1 year goes quickly. And I think we ought to, make sure that we go to the next step to help him get a job. I want to also thank Dr. Lugutera, and I'm putting the name out here now because when all of this was going on that day, she private chatted me that she will provide free counseling to him if needed. And it was very much needed. He has been in counseling. They have an excellent relationship. And she is providing all of that for him free. So we are grateful. And we say thank you, Dr. Lugutera. God bless you. Any other questions? So if anyone has a job, has ideas of what he can do, I told him I was going to update you all tonight. So I don't know if it's on the platform. Dr. Akose, if you're on the platform, kindly unmute. But if it's not, that's okay too. If anybody has job opportunities for him, he can work at home, he can work virtually. It's going physically that would not be, possible at this time. So any questions or comments?
I have a comment, question.
Hey, Dr. Motoshaw. Well,
Yes. How are you?
I thank you.
Yeah.
And it was so nice to see you last weekend. Yay.
Thank you. Just a quick one on Mr. Akose. Is there any plan for a long-term treatment, meaning transplant and all the 9 years?
Yeah. Excellent question, sir. As you know, even in your mad busy schedule, you came on after the meeting we had last time. You came on running, still in your suit, not having eaten, to a quick meeting we had where you have fantastic resources and all. I'm having difficulty there with him, and I can only do what I'm allowed to do and provide. So as we discussed, that's where it still is, to help him get a job and then see what he wants for his next steps. But you as a physician and me as a physician, we know, and all physicians on this platform know, that getting a kidney transplant would have been our, first and foremost thing that we would want to do. But again, we have to go with where he wants to be right now.
Thank you.
Thank you, sir. Any other questions or comments? So if there are no other comments, no questions, again, I want to say thank you to Dr. Famuyiwa, and thank you so much.
I'm sorry. You are going to share Dr. Famuyiwa's information.
Yes. Okay, Dr. Famuyiwa, please put your information on there. Make it easy for me, please.
Okay, no problem.
Thank you so much, Dr. Omotosho. Somebody private chatted me, and I was going to private chat them, but it's better for it to be up there because I'm sure some other people may need it and not want to speak up. What I normally do, she just put a contact on there. If you're on your phone or laptop, you can click on it and you'll go straight to the website. I usually sometimes also just take picture and so that I have it for those who need that information. Dr. Famuyiwa is a fertility specialist. She's one of our best in this area. And so what we talked about tonight is surrogacy, which is just a branch, an aspect of fertility. I like to call it fertility, not infertility. So the other aspects, IVF and stuff like that. She does it all, and she does it in a state-of-the-art setting, very professional setting, and she gets results. So if you need that assistance, please contact her. The number is 301-946-6962, and the website is faqmfc@gmail.com. It's the website. She does have a website. I think that's the email I told you. The website is www.montgomeryfertilitycenter.com.
Thank you so much.
montgomeryfertilitycenter.com. Thank you.
Thank you. My pleasure.